the moment Dr. Navin Dang, founder of Dr. Dang's lab, which is a very prominent testing lab in the national capital. Dr. Dang joins us this morning. Good afternoon, Dr. Dang. If you could just fill us in on the sort of samples that you're getting, where are these samples coming from? How worrying is the situation on ground?
Thank you very much for having me on call with you. Yes, as we all know, the number of cases are going up significantly. And the main cause, of course, is the lack of people wearing masks, the COVID-appropriate behavior not being appropriately followed as it was being done before. And with everything that is going on, we are seeing that the number of positivity is going up. And number of positives significantly is going up high in children also. And that's one point I would like to emphasize. I do not want the schools to be closed down, because that is again detrimental to the mental growth of the child. But proper precautions should be taken. Proper systems should be put in place that the children, all children, like all schools, should not be having the same timing for all the children to be going. The timings of school opening and closing should be staggered so that the number of patient positives coming from schools decreases and the exposure to the people who come to pick them up or drop them to the school should decrease.
Right. Dr. Dang, I'd like to interrupt you there. If you could also just give us an idea of what sort of samples are you getting? Are they more from children or adults, the age group, that you're getting?
Ma'am, here please understand that large number of patients are either not getting tested or they're doing home testing.
Right.
So what we are getting is only a tip of the iceberg. Now, maximum number of patients, excluding those who are traveling, are children. We are seeing a large number of children who are testing positive, and parents being more concerned about the children as they're not being vaccinated. That is high. And as the number of children with other viruses also going on, and children having other influenza-like illnesses also, the number of patients who are children or the younger age group, less than 10, are higher. And that is why maybe we are getting a large number of positives from them.
Right. So you're also mentioning that a large number of people at the moment are not testing or home testing. So that also adds to a worrying trend, isn't it? Because this disease is not really being taken seriously. Earlier, of course, we saw how the situation was quite serious, and everybody who even got mild symptoms used to, test. At this point in time, according to you, enough tests are not being conducted?
Absolutely right, ma'am. Here I would like to emphasize there's a difference between the two terms, worrisome and serious. Taking it seriously. Now, I believe strongly that it should be taken seriously, but though it is not worrisome at the moment, because we do not know what are going to be the long-term repercussions in children. The children population is not vaccinated. What long-term effect it will have, maybe after a few months or a few years, we have no idea. So I think all children who develop symptoms should be properly tested and, most important, reported also. In spite of the fact that the government has put in an excellent system in place for testing, tracking, tracing, treating, that is not being followed. Now, if a child is positive at home and that is not reported, the government has got no way to track that patient. And that child is going to spread it to so many others. So that is why I strongly want to emphasize through this media that the children should be tested properly and all positives should be reported and at least told to the school. Like I read in the newspapers that one child tested positive in a particular school or two children tested positive in a particular school. No, but that is because that is not the case. Rest assured that the large number of children who are testing positive but are not being reported, and that is, I can call it, very much detrimental to the whole society because they are the ones who are going on passing infection to others.
Right. Dr. Navin Dang, thanks for getting